Welcome to the Inspired Caring Podcast, where women who are in the messy middle of this big, beautiful, and sometimes chaotic life are finding inspiration and resources to care for themselves and figure out the best options to care for their aging loved ones. How we take care of ourselves today impacts how we are aging tomorrow. This podcast will help you feel seen, centered, and aligned. Everyone that relies on you is so lucky to have you in their life. The Inspired Caring Podcast is your reminder that the number one person that counts on you is yourself. Congratulations on being here in this moment. Let's dive in and be inspired. I am so pleased to welcome back Dr. Monique Nugent to the podcast. Welcome back.
Thank you so much for having me.
I had this really impactful, pun intended, moment recently when I thought we need to be talking about poop more. And I remember the episode that really swept the world back in the day on Oprah when she had Dr. Oz come on and talk about the time that it occurred to me that we should be paying attention to how much we're pooping. And I had a family member who went to the doctor because they were constipated, and the doctor said, eat a bowl of Raisin Bran in the morning and drink a glass of water. And like, lo and behold, all his constipation issues were solved.
Yeah, they probably were.
And I just thought how many people are ending up in emergency rooms or in doctor's offices with something that, with just a little more attention and intention, could be taking care of ourselves. So we're talking about poop today.
We are. I am thoroughly excited because I actually even have a section in my book called Number 2 is Number 1 for me. So as a physician, as a hospital-based physician, I spent a lot of time talking about bowel movements and how often people are going, what they look like, is there blood in it? So I love talking about having regular bowel movements because it's one of the things that if you're not doing it, you don't realize how uncomfortable you are until you start having good bowel movements. And I've heard that from patients over and over again that like, wow, I didn't realize how bloated I was. I didn't realize how I always had this low-grade nausea. I didn't realize how uncomfortable I was until I started paying attention to my bowel movements. So let's jump into it.
Yeah, let's talk about it. And there are specific conditions that can impact your bowel movements, like IBS, amongst other things. And so I think just starting literally at the beginning, what is, now I'm using the term poop, but what is it made of? Like, what is happening? Like, what is that?
Yeah. So what is stool? So stool is undigested food, water, some cells from your body, some of the lining of your intestines, mucus, bacteria. And then, you know, if you have undigested things, like if you eat a button because you're two, right, you'll find a button in there. So anything that like you can't absorb, your body's not using food-wise that you put in your mouth will come out. And that's the goal of it. So my father's a plumber and he says, well, you know, it's one way, you know, as long as it's going down, that's the important part. When it comes to toilets, then that's the important part when it comes to your GI tract too. Things should be headed south. So if you're constipated, it's a gradation. We don't just jump to being impacted. There's constipation, which is hard time having stools. You're not having regular bowel movements. And you're right, there are a lot of medical conditions that can cause constipation. Remember, your GI tract is muscle. So if you have underlying conditions like Parkinson's, spinal cord injury, things that cause neurologic changes, muscular changes in general, it's going to affect your GI tract. Also, there are common conditions like pregnancy, the hormonal changes that go on in pregnancy. You'll hear pregnant women scream about being constipated the whole pregnancy. And so there are a lot of medical conditions and people just jump to IBS. And IBS, there's constipated type, there's a diarrhea type, and it's kind of fluctuating between the two. But it's not just that simple that like, oh, it's only because I have this bowel issue. You could have other medical conditions going on that are causing you to be constipated. Excuse me. And then on top of that, medications can cause constipation. So opiates, pain medications are very constipating. And that's the one that people kind of think about off the top of their head. But if you have anemia, you could be constipated because you might be taking oral iron, and iron is very constipating. So if you have heart failure and you're taking diuretics to help get rid of water, what did I say stool was made out of? Undigested food and water. And now you need water. You need water for the bulk, you need water for the softness. And so those medications can cause people to be constipated. And so it's a combination of what you are normally feeling and doing, like if you have an underlying medical condition, if you're taking a medication, and then what your friend experienced is dietary changes.
Mm.
So here in the United States, we do not eat enough fiber. We just don't. And you would be surprised how many cases of constipation or bowel irregularity can be improved with changing your diet. The big glass of water, I had a gastroenterologist say a big glass of warm water in the morning. And I have noted that for myself, and when I suggest that to friends and family and patients, that one is really big for them too, because we're not drinking enough water. We're not getting enough water in the day. And get your fiber in, fruits, vegetables, whole grains, not processed foods. Foods that have been processed, they take out that fiber for you because processing, that's what your body does. It breaks things down. They change it from its original form into something else. And a lot of the times they've taken out that fiber in the process of it. And so there's a reason an apple a day keeps the doctor away. That's because an apple is chock full of fiber and water, and it can help you have good bowel movements. So increase fruits and vegetables. Something that I do hear though from people is if you don't eat a lot of fiber, right? You're not someone who likes a lot of beans. Like I eat beans in the morning. That's not a thing people do often. If you just go from like no fiber to I'm going to have the most fibrous breakfast, lunch, and dinner, you're going to feel bloated. You're going to be gassy. You're going to be uncomfortable. So ease your way into it. Ease your way into it. Start with that bowl of was it Raisin Bran, he said, in the morning and a glass of warm water. And then, at lunch, add some arugula to your salad, and an apple or a pear or something. You start adding little at a time, but don't go like hardcore. I'm gonna totally be a vegan and eat all my fiber 22 times a day because you will start feeling bloated and gassy.
Okay, so you have said multiple times warm water. Why
Yeah.
does the temperature matter?
I really don't know. I really don't know, but it's something that I see nurses do as well. Like every nursing institution has their own little cocktail. So, for things to really help patients. And so I've heard of like milk of magnesia and warm prune juice. So
Mhm.
I'm not too sure what
I
what
made a
the
face. I wrinkled my nose there.
I know, but I'm not too sure what the temperature has to do with it. But it does help. So drink your big glass of warm water in the morning. Not like hot burning, but big glass of warm water.
So what should our feces look like?
So it should be as adults, because your stool will change as you age, right? So babies, breastfed babies that have that yellow seedy stool, right?
Mhm.
And as they get older, and we all remember when our toddler started really eating, and then you were like, whoa, this is like regular poop in this diaper
Mhm.
here, right? But for an adult, your stool should be well formed. It should not be hard to get out, right? Like with a little bit of effort, it should be able to be passed. We do use the term birthed, right? So you
Yeah.
should be able to pass your stool with like just a little bit of effort, not too much straining. And it can change in color depending on what you're eating, right? So if you ate a whole bunch of blueberries or the beets is a better example. If you ate it like a nice beet salad, you might note that your stool is a little bit red. Red is different than bloody. You should not have blood in your stool at any time. And that is a big danger sign, something you should be concerned about. But it can change with what you're eating. And that will include the consistency of it, right? So on the days that maybe you're not eating a lot of fiber, or on the days you're not drinking a lot of water, it may be a little bit harder. On the days that, maybe you had a really good meal, you're out and about and you're, drinking your water and you're doing that, you might find it to be a little bit softer. So it can be totally on a gradation. Uh, but it shouldn't be bloody. It shouldn't be floaty. Your stool should sink, and it shouldn't be like fatty, greasy, overly smelly. It is not going to smell great, but overly stinky stools can tell us that there's a problem as well. So like blood that's been digested and it comes out in the stool that's sticky and dark and tarry is also very odorous. It has a really specific, what we say, melena smell, right? Certain infectious diarrheas have a really specific smell. Parasitic diarrheas can also be floaty and have really kind of odoriferous, like really specific smells. I'm not saying that like you're not going to eat a meal that does not agree with you and you've, had really stinky bowel movements and lots of gas and you should think danger, danger. No, that happens kind of to all of us, you know. But it's just like a pattern. If your stools are, really greasy, floaty, white, and this is just really consistent, then that's something you should seek medical attention for. Now, the other thing is the caliber of the stool, how large stools should be, can vary. I wouldn't think that there's anyone who would say like there's a stool that's too big and that's dangerous. If you can't pass it because it's too big, that's a different topic. It's likely too hard and needs to be broken up versus too big. But pencil thin stool, that's something that should also be of concern because that might mean that the stool is taking on the shape because of some form of physical block. But it's all really kind of going to change over time with what you're eating, what's going on, if you're sick or not. You may get a case of traveler's diarrhea if you go somewhere that, you drank the water or your sister-in-law, tried something new and, the whole family gets runs. It's okay for your stool to change on a day-to-day basis, but in general, you want as an adult, well-formed, brown, sinking, non-bloody, not too smelly stools.
I was gifted poopery for Christmas. So I don't know what that's saying about my stool. I never said that I don't stink, but that was pretty funny. And I'm using it, it smelled lovely. So you mentioned, so should we be going every day or how many days is like, so should we be going every day? And then what is kind of that tipping point of, uh-oh, we may have a problem here?
Yeah. So you should have bowel movements every day if you're eating regularly. You may find that if you're not eating regularly, like there are people who are hospitalized who haven't had anything to eat in a couple of days, they may not have like a regular bowel movement in a day or two, which is okay. When do we start worrying? I would say, what do you define as worrying? By day 3 of someone not having bowel movement, they should feel uncomfortable and start seeking some home remedies. And not saying that like I'm directing, that's like what people do. By the time someone hasn't had a bowel movement in 3-4 days, they are uncomfortable and they are like at CVS trying to figure out what they can do to help relieve this. People usually start seeking medical attention around day 7. Like I haven't had a bowel movement in a week. But if you're taking care of somebody, I really want you to pay attention to their bowel movements, especially if it's somebody who may not be able to advocate for themselves. if you have someone with dementia who is not going to be able to tell you themselves that, oh, I haven't had a bowel movement, I'm not feeling really good. I want you to pay attention to their bowel movements and really try to make sure they're having a bowel movement, if not every day, every other day, I would say would be something that would be the minimum. But you don't really want to go past like 3 to 5 days without starting to be concerned and thinking how you can intervene on that.
Okay, that makes sense. And I know, having worked in a memory care, how hard it is to encourage people with living with dementia to drink water. And if water
Yeah.
is part of the equation, it sounds like really incorporating some of those more, what I don't know, is water rich the right word? Like more of the apples and things that contain water.
Yeah, water-rich foods, right? Cucumbers are great. I once heard of I think she was somewhere in the Middle East, and she said a home remedy was like yogurt with grated cucumber. That's great because it's a lot of water and it's a lot of probiotics, and it's tasty. And if you are someone with dementia, that might be easier to swallow. So there are reasons why, like over the years, these home remedies come up. And yes, water-rich foods is a really good way to incorporate that. But getting people who have dementia to regularly drink water is a concern. So that's why I'm saying I want you to really pay attention.
Yeah.
Um,
So we've talked about different things that can influence the quality of bowel movement, and that has been medication, the foods that we eat, water intake. What about movement? I felt like you mentioned movement, like moving your body.
yes, movement is a big one. Movement is a big one. So if you have bowel surgery, your surgeon is going to ask you to get up and walk around because he wants or she wants your bowels to start getting activated or chew gum getting activated so that you're passing gas and eventually having bowel movements as well. And so that's why being sick and being hospitalized, you may find that your stools change. You're sick. We just talked about how medical conditions can cause you to be constipated. You're in the bed and not moving around. You're not eating or drinking because you're feeling nauseated. And then you're getting new medications that may cause constipation. And so this is why poop number two is number one in my book, because not paying attention to your stools can drag out a hospital stay because you may say, I really need to have a bowel movement before I go, or the doctor really wants to make sure you have a bowel movement before you go. And so it is really, really important that you try get up, move around as much as you can. It helps your bowels to really be activated.
And I'm thinking about even just like walking around your house or trying to get a walk around the block.
All of that,
All of that.
any movement, all of that will help you to maintain regular bowel movements.
I had a family member in the hospital and he was on clear liquid and they were wanting a bowel movement before he left. And he's like, if you give me coffee, I will give you everything you need. I will give you everything you need. And
Yeah.
so I don't know if that is an actual activator, but are there certain foods that are activators? Like,
Coffee, yeah, people do have bowel movements after having their coffee. Um, there are foods that can, like I said, be bulking agents, fibrous foods, things that bring in water. Um, and I'm sure that there are probably foods that cause a little bit of irritation to the GI tract or stimulate the GI tract in some way. But like you said, you hit the nail on the head. They wanted to see some brown gold
mhm.
before he left the hospital because the last thing you want is for someone to leave and not be able to have a bowel movement. And constipation comes on a spectrum. There's constipation where we talk about I'm not having good bowel movements. They're hard, not really able to pass very easily. And then there's obstipation where you're not even passing gas. And that is a medical emergency. So there's lots of very dangerous things that can happen if the bowel just isn't moving at all. And that's like a totally different, med student type lecture. But in the hospital, our big concern is we don't want you to get to that point of obstipated, that you're not even passing gas. You may be impacted, and impacted is a part of being constipated, where the stool is at the bottom and it's hard and it's not able to come out. And so impaction is very, can be very dangerous, but it also can be very tricky to diagnose. Because what can happen with impacted stools, meaning hard stools at the bottom that will not come out, is that the liquid stool above can just leak around it. And people will come in saying, I have diarrhea. And in the end, they get diagnosed with constipation and impaction because the stool is just constantly leaking around the hard stools. And you have got to remove those hard stools. And it is a physical disimpaction where, the nurse or the physician will take their finger and help to pull down and remove the stools so that you can finally pass all of that. And then you will start having good and regular bowel movements. We hope that's the goal. But diarrhea or just constant liquid stools can actually be an indication of constipation. So it's not just, oh, I'm not pooping. It can be a whole gradation and still say like, oh, it's because you're constipated that you're having these problems.
What are some of the really scary dangers? So, I mean, you talked about the danger of being impacted, and then there's the
Obstipation.
constipation. So, what are some of the dangers if each of those things are occurring? Like, how do we spark urgency with people if either they suspect that maybe there's constipation and impaction or the other thing?
So obstipation tends to be something that occurs in a medical setting,
Okay.
because it usually can occur around someone with like a known bowel disorder or someone who's had bowel surgery or they're on medications or they have an infection. People tend to show up well before they get obstipated. And the good thing about humans is that we're kind of aware that through the day we have a little fart here and there. And if you didn't pass gas here and there through the day, you would feel that and people would show up. Constipation and impaction are dangerous because the stool has to go somewhere. Like things
Right.
have to come out. And so what ends up happening is that like people will stop eating because they're so nauseous, they're so distended, it is painful. Or you get what I said is those liquid stools that are just constantly leaking. That's something that I see a lot in our elders is that they'll come in with constant leaking stools. And then you don't want to get to the point where it turns into a problem like a bowel perforation because things are not moving. And that usually takes a much longer amount of time. And usually by that time, someone has shown up. But what is the danger? The danger is that what happens if it doesn't come out? It's either going to come up if it doesn't go down, or you're going to stop eating, or it'll just continue to cause more and more blockage until you get into a surgical crisis. And so, we all like as teenagers sing the diarrhea song and, poop is kind of funny. I'm currently potty training a 2-year-old, and so we talk about poop a lot in my house, but I will tell you that it is a big concern. If you've ever truly been constipated, and you're not someone who lives with constipation, you will be like, I remember that time I was constipated because I felt horrible. So
Yeah. I think that the best case scenario here is that we're setting ourselves up for success to have a daily bowel movement.
yes.
And
Yeah.
so what I've heard you say is fibrous foods, drink lots of water, and move your body. Like exercise can help as well.
And be aware of the medicines that you're taking.
Okay.
That's something that I really want people to ask their primary care doctor. Like if you're struggling with constipation, say, is there anything on this list that could be causing me to be constipated? And is it something I really need? So ask about that. So one of the things I spoke about is iron for anemia, right? So people don't think of constipation and anemia going together, but because of that medication. And so maybe you don't need to take it every day, maybe a couple times a week. Can we, add some vitamin C to it so that I'm absorbing it better, right? Have that conversation about what medications you're taking that could be causing you to be constipated.
I appreciate that. And in one of my classes, one of my classmates worked at a pharmacy, and she shared that the average person living in a nursing home is on 24 medications.
Oh, that's very
That's alarming.
yeah, that's unfortunate. Polypharmacy is a really big issue, and once you start adding one medicine, then what you'll often find is you add another to, combat this or allow someone to be able to take that. With our elders, I always ask their caretakers to try and go over their medication list as much as possible with their primary care doctor. People in nursing homes might have a lot of medicines on their list, but they may not actually be taking those medicines. Some of
Mm.
those are what we deem as housekeeping medicines. So, like, they may have an as needed medicine for constipation, since we're speaking about that. So if you have a loved one in a nursing home, make sure you go over the entire list and ask what are they taking on a daily basis versus like how much of this medicine is here, because if they get gas pains, they don't want to have to call the doctor for a simethicone. The simethicone is on the list for gas. So just kind of things you would have in your medicine cabinet, the nursing home may want to keep on that list to be able to give the patient. But that doesn't mean that there aren't people out there with a ton of medicines. And so, yeah, take a look at your medication list as often as you can to see what you really need to be taking and what maybe you can do without.
One of the things that we noticed with my father-in-law, he has subsequently passed away, but had terminal cancer, is that he would have a hospital stay and then go to assisted living, back to his assisted living. And there would be medicines that would trail with him that he only really needed in the hospital. So I think that circles back to your point about reviewing that list regularly,
Yeah.
just to make sure they're taking only what's needed.
Yeah. Because they may do something like keep the anti-nausea medicine he was taking in the hospital on the list for him to go home thinking, oh, just in case he needs it. But if you don't need it, why waste the resource, the money, put it in your house to possibly take, like just if you don't need it, you don't need it.
Totally. I think food is something that as a collective in our country, we are starting to pay better attention to just the quality of our food, the quantity of our food. And I'm just thinking about people paying attention to when they eat something, how did it make them feel? And then keeping track of their bowel movements, like maybe we go out and I am working with a trainer right now because I have lost 4 pounds of muscle
Mhm.
in the last 10 months. That's pretty scary at 52. And he's like, sometimes you go out and you have some chicken wings and a couple beers, but I'm not going to feel very good. So I'm just thinking like in terms of our bowel movements and how that affects us, just paying attention to that.
Oh yeah. Yes, you should definitely pay attention to what foods help you to have good bowel movements so they can maybe be your go-to if if you're having a little bit of trouble. But there can be foods that cause people to have diarrhea. So if you're lactose intolerant, that's a big one, right? People who are lactose intolerant have to stay away from milk products unless they're, willing to risk the diarrhea or they've got their lactate, right? But individually, and I never say to people that things are not true, right? You never know like what 100% disagrees with you, like maybe it's the way a recipe is put together at a certain restaurant that like your stomach just doesn't like, or some fruit or vegetable that like you just can't really tolerate. It's okay. Take note of it and try to avoid it if you can, you know, um, or try and plan your day around it if you must have your ice cream and you don't have your lactate with you.
Plan accordingly.
Yeah.
Is there anything else that we need to know that we haven't covered about bowel movements and the importance of them and how to keep it going? Is there anything else
Yeah.
I'm missing?
No, I think this is a great conversation, and thank you for starting the conversation. It's one of my favorites, but it's something that I want people to pay attention to. It's not just a gross byproduct of, your day. It is important that you have good, healthy bowel movements, and you will feel better if you're having good, healthy bowel movements. But like I said, if you are taking care of someone and they cannot really advocate for themselves, they're not going to be the ones tracking their own stools. It will make your life easier if they're having good, healthy bowel movements, and it will make them more comfortable as well. So just pay attention to your stools. They are important. Don't just like flush it. You got to look at it. And make sure make sure there's no blood there, and just try to get more fruits, vegetables, unprocessed foods, water, get outside, take a walk, see the sun, and hopefully you can get on the good GI track for having bowel movements.
That's awesome. Well, thank you so much. What is the name of your book and where do we find it?
Thank you. The book is entitled, I rarely have a copy on my, oh, sorry. The book is entitled Prescription for Admission: A Doctor's Guide to Navigating the Hospital, Advocating for Yourself, and Having a Better Hospital Stay. So one of those semicolon long books titles. And you can find it on Amazon, Barnes and Nobles, anywhere that you buy books online. Pretty soon I will be offering it on my own website. And you can follow me and my work at my website, which is Dr. Monique Nugent, Dr. Monique, Monique, Nugent, Nugent.com. But yeah, pick up a copy and check out the little box that says why number 2 is number 1 to me. Because as a hospital-based physician, it is really important that we talk about your stools on a regular basis. Again, ching.
All the puns intended. Well,
All
thank
the puns today.
I will put links to how to connect with you and buy the book in the show notes for people. And thanks for being here. I'm grateful.
Thank you for inviting me. It's good to see you again.
Good to see you.
Bye.